in which the fist of the mallet appears to move downwards and backwards, to end at the navel. In the front and bottom, there is an area on which light is reflected, and it is called the luminous triangle. We will present illustrative forms of the functional anatomical features of the tympanic membrane, which are trigonometric space complex. We conclude from the above that there is a triangular geometric space component between the three sides, 1 the side tangent to the front edge of the hammer grip, which passes through the lateral process of the hammer. 2 the side tangent to the upper edge of the illuminated triangle. 3 the side connecting the front end of the upper edge of the illuminated triangle and the upper end of the side that is tangent to the front edge of the hammer fist. This triangle is located in the upper anterior quarter of the tympanic membrane, and it is almost right-angled, because its angle between rib number 1 and rib no. 2 is almost right, and this is in the normal anatomical and functional state, and within normal limits it maintains its right-angled triangular geometric spatial shape, and it changes spatially with its position in the anterior half of the tympanic membrane, but maintains its natural geometric shape. We have observed this clinically and endoscopically, so it can change spatially. For example, maybe we notice the hammer fist naturally moving forward and down in space, so the illuminated triangle moves back and up so that the angle between them remains almost right. And thus this triangular geometric space complex is anatomically variable. It has 3 sides, but the angle remains right. But what is the pathological significance of changing that angle? What diseases do we diagnose from this clinical anatomical and functional endoscopic change? Meanings of the Mallouhi medical sign in normal and pathological cases. 1 Natural state. The triangular geometric space complex is located in the upper anterior quadrant of the tympanic membrane, and is approximately right-angled, i.e. 90 is almost equal to degree. 2 Medical conditions. Its quality and pathology vary according to the changes in that triangular geometric space component, especially its right angle, YH, as follows: a 90 acute angle in the following cases: obstruction of the pharyngeal tube in the congestive stage, adhesive tympanic membrane inflammation. B 90 but smaller than 125 degree, in Thea diseases, serous otitis media in its early stages. Suppurative otitis media in its early stages. C. Yes, about 125, in diseases, delayed serous mucinous otitis media. D. Yeah, around 125-180 degree, in diseases, film color is opaque, delayed serous mucinous otitis media vary. The color of the membrane is opaque and reddish. Traumatic middle ear hemorrhage and longitudinal and transverse temporal bone fractures, skull base fractures. The color of the membrane is opaque bluish, glomus jugular tumor. H. Yes, about 180, in diseases, dense serous middle ear infection, glue ear. F. The absence of the illuminated triangle. The book can be downloaded from the web for details. In short, most diseases of the closed ear such as obstruction of the pharyngeal tube due to various causes, then serous otitis media in its various degrees, serous, mucus, and cerumen, and other diseases such as hematoma of the middle ear and jugular glomus tumor in its early stages inside the middle ear. The right angle changes from right to acute in the early stages of serous otitis media, for example, and with the progression of the pathological mechanism, the angle becomes obtuse to various degrees. In otoscopy with normal examination, we estimate the angle as acute, right, or obtuse. And for each closed ear disease, there is a specific qualitative angle that diagnoses this disease in addition to the history and the rest of the symptoms and signs. And practically, we shorten most of the expensive investigations. And we confirm that sign clinically, planning, radiologically, and surgically. Thank you and appreciation.